This article talks about psoriasis and atopic dermatitis' effects on quality of life in patients. They are chronic skin diseases that cause physical discomfort, consequences on personal and social life, and daily functioning. One central experience is stigmatization, the experience that others stare, feel uncomfortable touching patients, make annoying comments, avoid contact at all, overall, and etc. This greatly contributes to the impaired quality of life in patients. The article then explains the factors responsible for stigma in chronic skin diseases. The perception of being stigmatized is a function of several factors: physical, psychological, and social stressing. Lots of attention has been paid to skin status as a predictor of stigma, but there has been less attention paid to physical symptoms, itch, fatigue, and the possibly increasing feeling of being stigmatized through increased stress experiences. The article talks about social factors like support, as said to have also been suggested to be irrelevant in chronic skin diseases. Qualitative and quantitative aspects of support have been expected to have an effect on perceived stigma. Finally, the way that patients perceive and think about their disease has been widely accepted as an important predictor of health outcomes in other chronic diseases, particularly helplessness, which is emphasizing negative aspects of the disease and generalizing it to all aspects of a daily life, and acceptance, acknowledging disease and finding a way to live with it. They both have an effect on stigma. However, not enough study on these factors led their research. Methods: questionnaires administered to randomly selected 131 psoriasis outpatients and 139 outpatients. The range was 17 to 84 years old and 16 to 77 years old. The demographic variables were assessed. Educational level was measured. Age of onset was assessed, so the year that they were diagnosed. Skin status was assessed by a 9-item scale. Physical symptoms of itch was assessed by a 4-item visual analog. Symptoms of fatigue, disease impact on daily life, social support, and stigmatization were all assessed. Results: studies showed that most patients, 79% of psoriasis and 88% of atopic dermatitis, experienced some stigmatization. A higher level of stigmatization was related to lower age, being unmarried, worse skin status, more symptoms of itch and fatigue, a higher impact on daily life, cognition of more helplessness and less acceptance, and less perceived social support. A considerable amount of patients experienced a high level of stigmatization. Helplessness demonstrated to be the strongest predictor of stigmatization among all factors, suggesting that helplessness plays a central role with the experience to be stigmatized, regardless of the type of skin disease. This article has to do with my topic because my topic is about quality of life of patients with skin disease, and this topic talks about stigmatization causing an impaired quality of life in people with skin disease.